Hi, good morning, sir. Good morning, classmates. We are Group 3 from Level 3, Section 3. So we're here to present the first topic, which is assessing the effectiveness of virtual clinical education in developing practical skills of student nurses. So first, we can provide or we can present the introduction, followed by the statement of the problem, and lastly will be the review of related literature. So for the introduction, it will be presented by Mr. Ronnie Del Castillo.
Good morning, everyone. I'm Ronnie Del Castillo, and I'm here to discuss the introduction of this study titled Assessing the Effectiveness of Virtual Clinical Education and Development Practical Skill of Arellano University Student Nurses. Seek to assess the effectiveness of virtual clinical education in providing the practical skills of nursing students at Arellano University. Virtual clinical education has the potential to be valuable resources for skill development, but its implementation requires careful consideration. This include integrating it continuously into the nursing curriculum, ensuring a safe environment for practical skills, offering guidance for qualified educators, and conducting ongoing program evaluation to meet the needs of both student and educators. And the next is the statement of the problem that will be discussed by Vidalio.
Thank you, Ronnie. So again, I am Angelica Vidalio, and I'm here to present about the statement of the problems. So for the level 1 question, what are the effects of virtual clinical education and the practical skills development of the student nurses? So we've come up with the answer to understand how virtual clinical education impacts the development of practical skills among student nurses. It also seeks to explore the effects, both positive and potential limitations of using virtual methods in nursing education, such as assessing skill acquisition, confidence building, safety considerations, critical thinking development. And with the level 2 question, what is the relationship between the mode of clinical education and the proficiency in practical skills development among the student nurses? So we've come up with the answer that to determine whether virtual clinical education methods enable students to acquire and retain practical skills to the same extent as traditional in-person clinical education. And lastly, with the level 3 question, why does virtual clinical education affect the quality of the practical skills of student nurses? So, with the answer for this level 3 question, to determine the factors that affect the quality of the practical skills of student nurses. If those factors really affect the quality of the practical skills of student nurses. So, that's all with the statement of the problem. And next, we will be providing you also the review of related literature. So with the first related literature, it will be presented by Ronnie Del Castillo.
To make this study reliable, we look for related literature that would support our study. The first related literature is titled Comparing the Effect of Demonstration, Video Display, and Virtual Social Network on Nursing Student. Learning of Hemodialysis, Clinical Skill, and Intervention and Comparative Study. Their research revealed that students who were taught through online platform, particularly virtual social network, demonstrate enhanced practical skills acquisition. The study attribute this improvement to various factors such as flexibility, access, access to diverse resources, and engagement in active learning. These findings suggest that online platforms are effective tools for both teaching and evaluating hemodialysis skills. Next.
So next, we have the impact of online remote education on the learning process among nursing students. So with this topic, in relation to the main topic, it's because if well, actually, according to a study at MISR University, remote nursing education had a positive impact regarding with the online or doing an online learning or when they're doing the online systems and apps competent. But some reported students who experience anxiety during exams and inadequate time to answer questions. But however, over two-thirds agreed with the course content. But with the overall online education is beneficial, but it cannot fully replace in-person learning, of course. So with the third topic, it would be presented by Emmy Mauricio.
So, for the third literature that we have entitled Nursing Skills Laboratory as a Milieu of Clinical Learning and Practice. So, this study is all about evaluating the effectiveness of the Nursing Skills Laboratory when it acts as a basis for student nurses to improve and enhance their clinical learning and skills. As a result for this, the availability of equipment as well as the supplies were identified as a factor that affects the quality of the nursing skills, and that there should be an additional laboratory hours to further enhance the students' nursing skills. And then for the next literature, we have entitled students' perspectives on learning clinical nursing skills, a focus group study in Norway. So this is all about investigating the students' perspective or how they perceive the process of acquiring practical skills through focus group interviews. So the study highlights all about the importance of supervision in both simulation-centered training and clinical placements. And the study emphasizes that there should be a need for a more thorough and quality uh, planning when it comes to the training, and that the findings of this is that there should be room for improvement when it comes to the approach as well as creating the content for the practical skills. Now, for the significance of these two studies is that when it comes to our study, it acts as a support as well as adds substance when comparing the different modes of clinical education that we have. Where in these two studies, it showcases face-to-face or the traditional clinical teaching when it comes to enhancing the practical nursing skills.
Next would be Jose.
So good morning everyone. I'm Gilan Jose. So the fifth question next. So the title is the fifth question is influencing factors on nursing students' learning flow during the COVID-19 pandemic. So the learner's capacity to self-regulate their learning is crucial because each learner must go at their own pace without the aid of instructors in order to develop as healthcare professionals. In this dynamic learning environment, nursing students are required to reach their full potential and maintain a high level of concentration while studying. So next is the sixth topic, effectiveness of virtual medical teaching during the COVID-19 crisis systematic review. So medical schools have a big responsibility to the ongoing schools during the pandemic. It is a big challenges to traditional learning, including the limited hospital experience, to ensure they receive proper training and knowledge to become healthcare. So the seventh question is a systematic review of online learning and teaching strategies during the COVID-19 pandemic. So this research identified a strategy for online learning and investigate the implications for the education. So this study including how to apply or deliver the online learning method and improving the knowledge of the nursing students. So this study is to find out if the student nurses develop their knowledge and skills through online. So the eighth question is a little literature review on impact of COVID-19 pandemic on teaching and learning higher education for the future. So the online teaching and learning have opportunities for strong communication between between the student and professor using the online platforms. So this study investigate and explores the effectiveness of using online platforms. So the nine literature, instructional design and educational satisfactions for virtual environments stimulation is in undergraduate nursing education. The mediating effect for immersion. So the study is under the positive impact of virtual education, indicating that it is not only enhances learning experience, but also it is a motivates the student nurses to investigate the greater effort in elevating the quality of their education. So the next is Miss Angelica Vidalio.
Okay, thank you. And last but not the least, it's with the nursing education in a pandemic, academic challenges in response to COVID-19. So in relation with the topic, the relation of the related literature to our topic is to embrace the long-term pandemic and make sure that even if the clinical evaluation or learning is virtual, they will secure the medical students, most especially nursing students, to have their license as nurses. They should embrace medical students who learn from or came from online classes as the workforce decreases and more nurses are needed. So that's all for today with the Group 3 presentation. And thank you for listening. Bye-bye.